who may not be aware, Dr. Spencer is a gynecologist. He operates out of Montego Bay, and there was an Observer headline that says Mobile Doc returns tightness to vaginas. Gynecologist says procedure bringing back the love in marriages, and I can bet further relationships. So he's Dr. JERMAINE Spencer, and we are going to speak to him about this procedure, among other things. Dr. Spencer, are you there?
I am actually. I can hardly hear you though.
Okay, are you hearing me better now?
A little bit.
Okay, prober, turn me up. Okay, yeah. Now let me talk a little, because I have a big mouth, right?
Sure.
I don't think I need a procedure for that. But anyway, now tell us about this procedure. And I realize that I hope that they carried it right. It's called vaginal plastic surgery. Am I correct?
You can be correct, but that's not the terminology that we use. But
okay.
First of all, good afternoon to your listeners. Sorry it's a bit late, but I was actually seeing some patients.
We can understand.
Permission to come on the program.
Yeah.
But basically, what was publicized in the paper is a procedure called laser vaginal rejuvenation. Okay. So, in other words, using a laser machine to help to rejuvenate the vagina. When we say rejuvenation, why we need rejuvenation? That's the question.
Yeah.
Vagina relaxation is very real. And now this topic is a very taboo topic. We are a society that even despite the fact that we glorify it so much in the clothes we wear, in the dance hall, in our music and lyrics, we express ourselves. Talking about the sex and in terms of the women sexual area and the men, is a bit taboo topic. And it's just a matter of letting people aware that, hey, listen now, there's something available to assist women who suffer from this problem.
Yeah.
And the question is, how do I know that I have a vaginal relaxation, doc? And I was said, well, it's just not the same in comparison to what it was prior to having delivery, meaning not giving birth to a child. Okay, sex just not feels the same. And by so doing, we know that our sexual gratification is proportional to the friction that we feel.
Which is a tightness.
For the male and the female. Do you understand that?
Yeah, man, the tightness, man.
Great. So, you're drawing me out, man. So the bottom line is that we bring that gratification to the sexual pleasure, right? Okay. By rejuvenating and tightening the vagina.
Yeah.
Yes.
So tell me something, Doc. When you're doing your procedure, because for argument's sake, when I go and get a glasses at the optician, sometimes I have to go back because maybe it has squeezed behind my ears or it has squeezed my nose. How you know when it's tight enough?
Well, I'm not the one who will determine that. It's actually the patient. So they'll come to me and say to me, Doc, I want to be a virgin again. Doc, I want to feel like, they might use parameters which they may use to determine the size that they want it to be, maybe the size of their finger. They tell you, and they make no qualms about it. They say, Doc, I want to be the size of my finger or two, etc., without being too graphic.
Okay. All right. Now, the thing about it, Doc, what I'm concerned about is that you notice one thing in Jamaica, we can take something that is very medical or something that is very sacred, and it becomes popular culture tomorrow because we see eye tattooing, which is a procedure that is really used for a particular condition, especially in glaucoma cases. And we have other examples out there that all of a sudden it becomes part of popular culture. Now, I'm asking you, do you think that this procedure might eventually creep into our popular music where you just have an influx of person just out of the blue? Because we even had a situation the other day where it was in the newspaper where young boys in high school are taking sexual enhancement drugs to overperform. And these are young boys. So what is your fear about this becoming maybe a popular cultural procedure?
Well, first of all, when a patient comes to me, I educate them. That's the first thing. You have to educate them to let them know what this procedure is about. And not everybody who comes to me and wants this procedure, I do it on. because not everybody needs it. Okay? So it's a matter of perception and what you think and know. And then therefore, based on my examination, there are a few things that we do when we examine in terms of how to contract the muscles. There are some women that the Kegel exercise, for example. I know this is a traditional method what women normally do to help to strengthen the muscle, but for a percentage of women, the muscle is damaged, and I don't want it to be a situation where it is looked upon as if bad. It is a medical issue or a medical disease. Vaginal relaxation is real. It's just a matter of the fact that we just don't talk about it. So it's a medical condition. Don't get too carried away from that.
Okay.
So based on that diagnosis, which is made based on talking and examining the patient, then procedure is recommended or not.
Okay.
So it's not a situation where everybody wants, everybody gets it. Okay? Because I have to still do no harm to the patient, and I will have to educate them on that basis. All right?
Okay.
So that's the bottom line. But in the sense that it is already in our media from long before, in terms of, if you listen to some of our dance, they use needles to refer to the eyes. You know what I mean?
Yeah, man. Eagle eye.
So it is there already. And there, of course, there are women who feel bad because, listen, they got a laceration during delivery, they got a cut during delivery, it wasn't sewed properly, and then for you know, the circumference or the opening is not as tight as before. And I'm saying to you, this can be due to childbirth. It can be genetic basis. You understand what I mean? The wear and tear of muscles, the gravity aspect of it. So we don't want to get too carried away to stray from the fact that it is a medical issue.
No, doctor. For somebody who is listening and might be contemplating, because they might, everybody know them situation. So we don't need to talk about them situation. Everybody know them situation. So for somebody who might be listening now and might be contemplating this procedure, now what cost are we looking at for the patient, and how long is this procedure in terms of the recovery period? Because there must be some recovery period.
Of course, it's surgery itself. Okay, I don't work in isolation. Henceforth, I work with a team, including an anesthetist who puts the patient to sleep if they so desire, and based on the severity of the problem. I also have an assistant as well. So in terms of, it depends on the severity of vaginal relaxation that is present. That will determine also the cost and also the length of surgery. Ideally, it can range between half an hour to as long as an hour and a half, as much as possible. So in terms of the cost variation, maybe as little as, I would say, 150 to about, depending on how bad it is. So we can start off at least. But again, it depends on the severity of the disease. Okay?
Now, the other thing now, would you recommend this procedure for persons who are still looking at having children? Because after spending $150,000 and then you find out you're pregnant tomorrow, and then you're going to have to spend maybe $200,000 down the road, would you recommend this procedure for persons who are still considering having children?
Yes, I would, if they have a problem.
Then the pain naga hata.
Sorry?
The pain naga hata.
No man. The misconception is this, that people may have, that if you do tightening, it can't go back. Remember, the vagina is a wonderful organ in the female's body that accommodates accordingly. Okay? So depending on what you do as a surgeon, we'll then educate them, say yes, whether you can continue to have a vaginal delivery or not. So in between cases, if they spread their kids between each other 5 years, 3 years, it doesn't matter. If you have a medical issue, it needs to be solved, and I want to stress that point. So yes, you can do the procedure even if you contemplate having a kid, having more children, and also have a vaginal delivery.
Okay. Now the other thing is that and we want the persons listening to be clear of what is the recovery period. Can we do the procedure today and then say, okay, we become sexually active 2 weeks time, 1 month time?
The normal recuperation period that we advise is no sexual contact between 4 to 6 weeks. And it's the same recovery period just after you're having delivery. Yeah, you've been delivered. You're having a baby, 4 to 6 weeks.
No, because what I'm looking at, why I repeat after you, I said 4 to 6 weeks, is that, Valentine's Day is February 14th. And even if our listeners are thinking about coming, 4 to 6 weeks is kind of, that means we're going to have to push Valentine's Day forward.
No, listen now, let me tell you. There are other aspects what we offer other than just surgical, you know. There are non-surgical techniques that can be done to assist sexual gratification if that's where you're going. There's actually an injection, not a surgery, an injection that's called G-spot. That's like the normal G-spot.
Okay.
It's called a G-shot.
Oh, Lord.
There you go. And basically what it is, it's a filler. Is where we basically insert a filler in the G-spot area, so it heightens the sensation entirely. That will be a great Valentine gift if that's where you're going.
Oh, Lord. How much for that one? How much for that one? Tell the people them fast.
No, the cost for that one is $50,000.
$50,000
for an entire year.
So the G shot of $50,000 and it's right away.
Right away.
Right away.
You can use it as you leave the office. You can go home. Simple as that.
All right. So you get your G shot and you go home and you're ready up.
You're ready up.
No, the other thing.
Go ahead.
No. I understand that now. So the rejuvenation procedure you said is 4 to 6 weeks. So we can't work with that one for Valentine, but we can work with the G shot.
No, you can work with the G shot for Valentine. It's just one injection. It's just one injection. Just one single injection. And the height sensation, you'll be more aware. If it takes you 15, 20 minutes to reach that point, it will take you about 5-10 minutes to reach that point.
Man, oh glory. Yeah.
So it is heaven sent. It's manna from heaven.
Okay. Manna from heaven, like Moses.
But I must tell you though,
yeah,
apart from the G-shot and the vaginal rejuvenation from the laser, some women suffer from what you call asymmetry of the vagina.
Asymmetry of the vagina.
The outer lip of the vagina is protrusive.
Oh, okay? The tongue.
Yeah, if you want to refer
to the tongue. Yeah,
terminology. So it is a little outside, and it causes irritation when you have on tight jeans. When you have on the bathing suit, it causes bulge, and it's kind of repulsive.
Yeah.
So there's actually a procedure for that where we call designer vaginoplasty, where it basically makes the vagina in one symmetry. The use of the laser to basically shave it down, for lack of a better term, and fix it then. So the outer and the inner lip is of same length.
Okay. So you're trying. All right. Now, what other procedures do you do at your?
Sure. Well, we're located in Montego Bay, Bay West Wellness Clinic at the Fairview Town Center. Okay. And also, what we do is there's another procedure called hymenoplasty. Now, you might ask, why they need to put back the hymen?
Yeah.
So, and the terminology we use is what we call born-again virgin.
Okay. Yeah.
So, we basically put the hymen intact for many reasons. One of the most popular ones is for religious purposes.
Okay.
There's some who make mistakes, right? And there's some religious groups who you know that you have to, for it to go into a marriage, you have to be a virgin. So that aspect. But some women do it just to give something back to their husband on their anniversary, or whatever reason. But that's a technique that's available as well.
Okay. Now, okay, we need your contacts though, because we have to go, and we are enjoying this interview, and boy, the studio pop up. I have to be touching people to tell them to keep quiet inside here. Now, can we get your office contacts for Mobi? Or give us the name of your office, your medical office.
It's called Bay West Wellness Clinic. We have 2 locations in Montego Bay. But the Fairview Town Center is our flagship location, which is actually open 24 hours. Not to say I'm here waiting on 24 hours. It's by appointment basis. We do other things here in terms of a casualty setting for wellness care.
Okay.
But the office number is 622-6508.
Okay.
Again, that is 622-6508. Our cell number is 550-1301. 550-1301.
Okay.
But you can also look us up. We have a website up, Bay West Medical Jamaica. You can just Google my name, and the information will also come up. Dr. JERMAINE Spencer, obstetrician and gynecologist. Okay,
so the website is Bay West?
The website is Bay West Medical Jamaica.
Okay, Bay West Medical Jamaica.
But if you type in Bay West Wellness Clinic, it will basically pop up.
Okay. Dr. JERMAINE, boy, I
Yes,
tell
sir.
you, the females and even the males appreciate the investment you have made in yourself and investing back in Jamaica, so that our relationships can prosper and glorify the Almighty. Right?
Very good, sir.
Yes, man. So what good, Dr. Jermaine, and
I
if
will,
anything,
sir.
we will
Same to you,
contact
man.
you back again. And I
thanks for
hope,
giving me the opportunity to share.
yes, man, and
with
your
the
office
people.
we're full of patience. Trust me, Valentine's is around the corner. Okay?
Thank you, sir.
Yeah, man. Walk good.
You too, man.
Thanks for listening to Entertainment Trail. Join us next week for another exciting episode. Entertainment Trail, blazing a trail for others to follow.